They're going to be nice and tight.
Use your antecubital fossa to control the lower extremity. You want to keep the knee in extension. Okay? What you want to do is find what your playing field is. In other words, where are you going to go to? So I'm not going to go much further than this. I'm not going to try and get to here, because I'm obviously going to tear his hamstring like this. So you want to see where is it that you have that end range. Okay? Your leg should be back like this. Because when he pushes, if I stand like this and he pushes, he very easily can knock me over. But if I do this, it'll be much harder for him to knock me over. Okay? So push down hard. Really push. Don't hold me hands, just push. I'm going to count backwards. 3, 2, 1, and then you're going to relax. Okay?
Relax or go with you?
Just relax. Okay. 3, 2, 1, relax. Now, if I asked him to lift it, it would be crack. But since I just told him to relax, it's PFS. That's the difference between the two. Okay? Alright? And then repeat the procedure on the other side. So it's 10 seconds of contraction, 10 seconds of stretch, and then 30 seconds of rest. So then you would do the other side. Okay? So all the hip flexors, would you sit on at the end of the table, please? So would you lift this leg up and back? So, notice that his rectus femoris is very tight. So iliopsoas is just going to be straight down. Okay, so I don't want to start here though. Where do I want to start? Good evening. Looking away from you. I want to bring this up a little bit like this. Okay? Because I don't want to start at the end. I want to bring this up. Okay, so you don't want to start at the end of the range. You want to start somewhere in the mid range. So push up a little bit. Now push hard. 3, 2, 1, relax. Okay, so that'll be iliopsoas. Rectus femoris, you want to do a little bit of extension, and then you can use your leg to do this stretch. So here's about where it stops. Okay, so you're going to be here, straighten your knee.
Which one?
Rectus femoris. 3, 2, 1, relax. Okay? For the adductors, I'm pushing this way, and I'm going to be pushing down and out this way. So that's fine, right? Because we're pushing in opposite directions here. So notice that his pelvis doesn't really move. So I want you to push up and in. 3, 2, 1, relax, and then you can go down and out. Now TFL, I'm going to be pushing this way, but notice, because I'm already pushing this way, his pelvis moves. So I need to stop that from happening. So I'm going to hold on the table here for my steadiness. I'm going to grab his pelvis here, and then what I want you to do is with this leg, I want you to push up and out. Up, 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 and out. Yeah, and push. Really push. 3, 2, 1, relax, and then you just step down. That's TFL. Sartorius, hold that there. Yep. Sartorius, you're doing a little extension and then internal rotation. So I'm going to push into my hand. 3, 2, 1, relax, and it's going to be like that. Okay? So that's sartorius, rectus femoris, hip adductors, TFL, and iliopsoas. Gastroaxillary, slide all the way up on the table, please. Okay, I'm going to take your shoe off if that's okay.
Yeah, that's fine.
Okay. Right hand goes to the right hand and the right ankle. Okay? left hand goes to left hand. That's how you remember this. Okay? So, for the gas rock, I want to keep his knee straight. Looking at my playing field here. Now bring your foot down a little bit. Now this one. 3, 2, 1, relax. Okay? For the soleus, you do the same thing you would have been making. Push down. 3, 2, 1, relax. Okay? Any questions on that? Upper traps and the base head. Can I go over to Shannon as you meet?
Whoa.
Okay, so we don't want to whip his neck around and give him a whiplash injury. Okay? So instead of using his neck to stretch the upper traps of the latest scap, we're going to use the shoulder. So I want to find my playing field. Okay, so come like this. I'm going to come back a little bit, and now I want to ask him to push his shoulder up. Really push. Okay, 3, 2, 1, relax, and we're going to bring it down. Okay, this is also excellent. An excellent position to do PIR if you have some restriction in the range of motion in the cervical spine. Say you have a herniated disc in the cervical spine, or you have degenerative arthritis, you have osteophytes, the uncinate processes are hypertrophy, they're closing down in the foramen. Okay, so you have very little range of motion here. Just bring them whatever your range of motion is here, and then you have them push up very lightly. 3, 2, breathe in. Keep pushing here, sorry. I'm conflating the two procedures. Breathe out and relax up the strap. Okay, so that would be PIR. Okay? PFS is ballistic stretching, right? Very quick. For the levator scap, because we're going to be pushing down the scapula, we don't really need to do this to bring the superior angle down and out. Okay, so we're going to do very slight rotation away and in the direction of his nose, like this, and then I'm going to ask him to push up. Now this time, I'm going to count 3, 2, 1, and I want you to bring your shoulder down as fast as you can. So this is going to be crack. Push, push, push. Really push. Good. 3, 2, 1, down. Okay? Any questions on those? No? Okay. Pec major. Okay, so pec major, generally speaking, the lower fibers are what are chronically tight on people. The middle fibers, rarely. The upper fibers, I've never seen it. Okay? So, how do you check the different fibers? So, the lower fibers, you have them all up high. So, we want to bring you down a little bit. I don't want the shoulder to be impinged by the headrest. Okay? So, I'm going to use my arm to stabilize his thorax. Bring your arm up a little bit. Now, I don't want to start here. I want to start up here. Push up hard. Really push. Come on.
I'll throw you off of me.
3, 2, 1, relax.
Ted, you're missing out on this one.
Okay?
Which muscles though?
That's pec major.
That's your soleus.
To the side, Butch.
Oh.
QL. Line your side facing that way, please. Okay, so this is a visual, the assessment is visual on this one. You want to line them up in the frontal plane, and now I want you to use your bottom arm to push up into side posture.
Bottom arm.
Push up.
bottom arm, put it down with you, and push yourself up.
Oh, got it.
Put this hand here.
Oh.
Hand, not elbow.
Extend your arm, elbow,
And push
extend your
up.
elbow.
Like that.
Oh, like that? Yeah? Okay, so what we're looking for is flexion at the head. So he's having a little trouble doing this.
A little awkward pose.
And then the other way to see this is to come behind him like this, find PSIS, find L5S1, and then see if he's bending at that. So he's actually doing a pretty good job. He's pretty lined up here. He's bending a little bit at the hips, and see his curve here. How nice that is. So his downside QL is probably not chronically tight. Okay, doesn't look like it's chronically tight. Come and see.
Come look out. And a beautiful curve, Jordan.
So here's PSIS. We shouldn't see any movement here because that's the sacrum, right? S2, S1. Here's L5, S1. And notice from here up, he has a nice curve. So that means this side QL is not chronically tight.
It would be just kind of more horizontal.
It would be just
here?
straight like this,
Okay.
and then he would start bending.
Okay.
Believe me, we'll find somebody else. Let's have somebody
Ted.
else. Thank you.
Definitely Ted.
Ted.
Ted has everything wrong with him, so.
So first we want to line him up in the frontal plane, which we can't really do, so that's an indication. See how bent he is here? Much more this way.
You're horrible, dude.
Ted, be quiet. We're talking.
So, PSIS. Now, he's actually bending at the LS junction is bending like this, but then the rest of it is totally straight. So he looks like, Jordan was like this.
Like a star and then a
Okay.
stoplight.
Ted is like this. Okay, so he's bending here, but not here. And then the other one would be,
Oh, so it's only medium bad, right?
Medium bad.
okay, so, treatment. I want this arm above your head like this, please. Just like this, okay? Now, you're gonna lift this hip all the way up to the ceiling. Good. Oh, man. Now, I want my hand on the posterior greater trochanter, because I know that he's a flexor. I want to prevent him from flexing. 3, 2, 1, relax. I'll tell you, it's a great stretch.
He doesn't look happy.
We're not trying to make people happy. We're trying to help them.
Come back.
It hurts, right? But
Yeah, but like, it feels good. Like,
but it feels good, especially afterwards. It feels
Yeah.
great.
Okay. I'm trying to
Okay.
make him happy.
All right, any questions on the QL? This takes practice, but I promise you that the smallest doctor in here can treat the largest person in the room with no problem at all. If you practice it, you get it down. The things you want to keep in mind are you want to have your foot underneath your knee. You don't want to be like this, because that's very unstable. So you want to be like this. You also want to have their legs as far up on your hip as possible. And then use your antecubital fossa to hold their lower extremities like this. And then of course you want to keep them from flexing. So put your hand on the posterior greater trochanter. Now you're not resisting at all. When they push up, you're not resisting them. You're only resisting when you lift from them flexing forward. You want to keep them in the frontal plane. Okay? Sure. Jordan. Bottom arm over your head. Okay, why do we do this? Why do you think?
Because of
Well,
Yeah.
it's pulling on the QL. Okay? So. Okay, so notice I have my foot underneath my knee. I have his legs all the way back against my head. Lift up.
Wait, lift up.
Lift up, right?
How do you lift up?
Like this. That's
Oh, like that?
Yep.
That feels good.
now that strike a pose.
3, 2.
Wait, where am I going?
Relax.
Oh. Ooh,
Ooh.
feels good.
I'm so nervous.
Okay?
That was a nice stretch. Yeah.
You got that?
There's no other way to do that.
Sorry?
There's no other way to do that. Like I just feel
You
like
probably could do it, let's say we're doing this upside. Okay, put this arm over your head. Then you bottom knee up toward your chest. You probably could do it this way. Push up really hard.
I like that.
3, 2, 1, relax.
Definitely not as good.
It's not as good.
but
I mean, you can do it that way, but it's just not as effective. Okay? And again, if you practice this, you're gonna get good at it, and it's not gonna be a big deal. I mean, you saw I wasn't like, you know.
yeah, but you're also a bigger guy.
I promise you, there was a guy who graduated, Darryl Easton Martinez. He was a football player. His shoulders were like this. He had to be 6'5" and at least 300 pounds. And most of us. He's a chiropractor.
He must be one intimidating chiropractor.
He's
Can't imagine walking in.
big, huge guy. I mean, he's like a monster. You walk in the room and you got to be like,
It
whoa.
breaks me.
Yeah, he's a monster. He's just jogging.
Where does he practice at when he
You're like, and we had the smallest woman in the class, and she was able to treat it, no problem. I mean, it took a little practice, but once she could practice it, she was fine. Okay? Next one is a rectus spinae. Would you sit up, please, and face that way? This is another visual. Slide back. Slide back all the way back.
Where am I going?
Seated. Okay. So, what I want you to do is bend forward and touch your toes if you can. So, what we're looking for is, he's bending very nicely here. So we're looking at PSIS. And we're trying to come to L5S1, and then we're looking for a curve. So this is absolutely normal. Okay? Let's have somebody else who knows that they have type of that. 10 again? Okay. Have a seat with your feet straight out. Okay, so bend forward. Okay, yeah, perfect. Well, notice the difference here. You see how flat this is?
Yeah.
And where does he start bending? All the way up here at the TL junction. So his, yeah, you see it now, right? You see the difference? So his, yeah, you can't even reach his feet. Right?
Yeah. There you go. Don't look up.
I lift things up and
But
put them down.
he's doing most of it right here. He's got very little curve here. Okay? So there's a couple of ways to do this. Lying the side facing away from you.
Y'all gonna sell his bags too for
Put this bottom arm behind you. Let it hang off the table. Just like that. So he's sort of between sideline and prone. Okay? So there's a couple ways to do this. You can use your hands like this on the ASIS and on the ribs. Okay? And then he's going to push back and forward here. And then 3, 2, 1. And then you can do this. Or you can use your arms like this. Push back. 3, 2, 1, and relax. Okay? I have seen people do it face up. And bring your knees to your chest. So, yeah. So I have seen people do it this way as well. So push down.
Don't tighten up.
And then 3, 2, 1. And then that. I don't think that's it. I don't think that's
It
it.
felt better the other way.
The other way you felt
Yeah.
much more. Yeah, that I don't think is right. Have you seen any other way to do that? Okay. So, Dominic Fiore used to teach here. Phenomenal adjustment. Do you know Dominic? He actually almost had a fist fight with one of the other professors. He was like,
Let me guess who.
Super hyped up on that. He did, the XYZ, you know. It's a real daddy guy. He walks like this, you know. But he was phenomenal adjuster. He was just like super crazy. Him and Pearl. What? Him and Pearl.
Oh, I bet.
You're kidding.
Yeah.
Yeah,
It's
shot.
the first person that came to my mind. Yeah.
Anyway, he used to do it this way. So I don't think it's that effective. Any of the PIR that you want to see?
Can you do the scaling?
Which one?
The scalings and the.
Scalene, sit up, face that way.
Oh, it's 10. No, it's
So for the PIR, I expect you to know the referral pattern, the assessment, and the treatment. So if you have any questions on any of it, now's the time to ask. We do have an exam coming up. Midterm.
That's so far.
We're already this is our 5th week, by the way.
Yeah.
All right, so it's not like it's that far off.
Just tell me that 2 days in advance.
So if you, well, I don't think it's gonna be like that. You're gonna need to know all the patterns also.
What are your nice hands?
All right, so turn your head this way, please. Turn hard. Okay. So I wanted to get his SCM to pop out. I'm gonna go between the two heads of the SCM, just above the clavicle in the supraclavicular fossa. So I'm gonna take a little slack off and come in here. This is anterior scaling. Now, pulling the clavicular head out of the way and going deep is the middle scaling. And then coming in front of the upper trap and medially up against the cervical spine is the posterior scaling. Okay, treatment, I'm gonna anchor here. Anterior is gonna be 45 degrees of rotation, 30, and then posterior, I'm gonna anchor here and do 0 degrees of rotation. Now, what I'd like to see you do is use this hand to come up on the cervical spine on the opposite side of what you're treating. And use it as a fulcrum. To fulcrum over, you're gonna reach over the head and grab the upper cervical spine. Vertical to lateral flexion. Okay? So this is anterior, middle, posterior, wrist switch. Okay? That's scalenes. Any others? Do you remember how to do these suboccipitals?
No.
Face up, please. So, head on you want to lower the head rest. What I want to do is, well, first of all, let's do this. Everyone, take your fingers and put it on your suboccipital muscles like this. Now I want you to look up with your eyes. Don't move your head, just look up. Feel it contract. And now turn your eyes to the right, but don't move your head. Look to the right, then look to the left. You feel them contracting?
Should I?
That's all you need. That's the contraction you need.
I don't feel
These are
anything.
more proprioceptive muscles.
You don't know.
I don't have 'em.
You don't feel it?
I don't feel that at all.
It's very slight. I mean, it just barely moves, but they're proprioceptive.
Huh?
They're actually yoked to the inner ear and the eyes through the medial longitudinal fasciculus. And it's so you can track, let's say, antelope is running across the plain and you can watch it like this. and move your head without falling over.
Ah, yes, my antelope hunting hours.
Alright, so let's go back to this. Okay, so I'm going to do a little traction, and I'm grabbing his forehead, and I'm putting him into a little bit of upper cervical flexion. Okay, I want you to look up with your eyes, and that's enough of a contraction. Take a deep breath in, hold your breath, keep looking up, hold your breath, keep looking up, look down, breathe out, and relax. As he looks down, look at how much I got out of that. Okay, and then short and long is going to be like this.
Can you do a crack on that or no?
Now,
Did you do what?
these are not prone to chronic pain. I mean, you can do a quick long axis traction,
Yeah.
but you're not really getting the suboccipitals. It's so tiny. Okay, any questions on that? Any others?
I'm showing you Rector's.
Sorry?
Rector's fine. Yeah.
Sure. PIR, sit up please. Okay, so
Usually.
for the semispinalis is almost in the midline, the mid-sagittal line. Okay? So, well, first of all, the palpation is just, I'm coming here, I'm going perpendicular to the fibers. Okay? That's pretty simple. Now, I want you to make a box with your arms like this. I'm going to reach under the box, now relax. Okay, so, you okay? Tuck your head in. So I'm going to find the trigger point, and I'm going to use either the heel of my hand, or I can use my thumb, I can use my knuckle. And what I'm doing is I'm kind of using my arm as a fulcrum. Now, because this is near the mid-sagittal line, what I want to do is I want to bring this to the mid-sagittal line. I want to do a little bit of lateral flexion, a little bit of rotation, and now he is in the mid-sagittal line. And now I'm going to push like this. Okay? Now the longissimus is a little bit further out, right? So now here's my mid-sagittal line, and let's say this beauty mark he has here is the longissimus. So what I want to do is I'm going to do a little more lateral flexion, a little more rotation, and bring him to that mid-sagittal line. Okay? The iliacostalis is all the way out here. So now I'm going to do even more lateral flexion, more rotation, and now like this. And that's a pretty good stretch, right? Can you feel that?
Yeah.
Okay. Now another way to do this is really not PIR at all. So, and this works really, really well. Face down, please. So you don't want to stand here because you're going to be asking the patient to extend up like in the cobra position. So obviously that would not be appropriate. So you want to stand to the side a little bit, okay? And without using your arms, I want you to arch up, lift your shoulders up, good. And then I'm going to find the trigger point and then down. All the way up and down. Now you can do this also on a ball, an exercise ball, because you're getting a little bit more flexion. The only problem with that is it's pretty unstable, so you have to like wedge it next to the table and or have them hold on to the table or push, hold on to the wall while they're doing it, that kind of thing. But it can be a little bit more effective because you're getting more flexion.
Could you potentially use a Bosu ball, so like half like underneath on
Yes,
the table?
absolutely. Or you could do a Dutchman roll underneath the abdomen, okay, to get a little bit more flexion in there. Okay? All right, and we saw the PFS for this. Okay? Anything else?
Do we do PIR on the TFL?
We did not, but you can do that. Okay, so abducts the hip and rotates it in. So we're going to
Just
do
inward rotation.
adduction and external rotation.
Yes. Yeah.
Okay, so if you want me to show you that line aside, it doesn't matter, whatever. So we're going to come back towards me a little bit, bend this knee up to each other. Okay, so whenever he's got his knee bent like that, that'll make him a little bit more stable in his area. Okay? So we're going to bring you back like this and do a little bit of external rotation. And hold here. Okay? Similar to the glute min anterior area. Okay? Thank you, Ted.
Anything else wrong with me?
Well, do we have time for that? Any other questions on any of these? Do you want to practice these now?
Yeah.
Okay, just a couple of things I wanted to show you real quick. that I did show the other class.